Tonight, more families are sounding the alarm. A few weeks ago, we uncovered distressed children sleeping on floors and in hallways inside an overcrowded mental health emergency department. It is a problem we learned spans to other hospitals throughout this area and the state. A lawmaker told our Nate Morabito the only way elected leaders will ever make mental health a priority is if they hear from outraged voters. So tonight, Nate Morabito is seeking solutions.
They're about to hear from an angry and heartbroken mother. Her preteen is battling suicidal thoughts. She says one overcrowded hospital turned her daughter away, and two others forced her to sleep on the floor and in a hallway chair. Long before COVID-19 shut down schools and isolated children, this woman's daughter,
on her worst days, she is very dark.
Battled despair.
She does resort to self-harm. She is suicidal on her worst days.
Then the pandemic.
It feels like I'm one step away from losing my firstborn child.
Made it even worse.
I feel so sad that at 12 years old, she feels that it would be better to not be alive.
Due to the sensitive nature of her mental health, we've chosen to hide her and her mother's identities. Medical records show Behavioral Health Charlotte treated the girl for suicidal ideation multiple times over the last year.
It was so overcrowded that she had to share a room with 3 or 4 other girls.
Emergency departments like this one have become the safety net for patients with mental illness and substance abuse disorder, a holding area for children waiting on beds elsewhere.
She was forced to sleep on the floor. She was also forced to sleep in a chair.
Kids who've said they had to sleep.
I slept in a chair in a hallway. I witnessed kids sleeping on mattresses on the floor, some of them in the bathroom.
In chairs and on mattresses like these. In your heart, as a mother, how does that make you feel?
Angry. Who wants their child who is sick and who is suicidal and who feels like they don't have a purpose for living to sleep on a floor? That does nothing but strip her dignity.
A Fort Mill father expressed similar outrage at the length of time his son spent in the hallway without a bed at Behavioral Health Charlotte last month.
This is no one's fault in particular. This system has been created over decades.
Citing a spike in emergency department behavioral health discharges for kids, the North Carolina Healthcare Association and 11 other organizations recently called upon the governor and other state leaders to do something about the full-blown state of emergency.
What is the General Assembly doing right now to try and solve this problem?
We are not doing enough.
Representative Carla Cunningham is a registered nurse.
It's tragic, and we must find some alternative ways to address it.
The House Health Committee member says she's heard from concerned parents too, both here and across the state.
There are children in Stanley County that are waiting. There are children in other Montgomery County that are waiting to get proper placement.
She says North Carolina's mental health system was already strained before the pandemic, and the last year has only made the problem worse. Cunningham tells us until lawmakers are willing to dedicate recurring state money to alleviate overcrowding, there won't be enough beds.
I hope somebody start pounding on that door.
Do you think this is a priority?
I do not. It absolutely is not a priority.
Enter this mom on a mission.
Absolutely devastating, soul-crushing.
A mission to turn that pain
I want her to be happy.
into a promise
I want her to be healthy.
of better care and family support. Atrium Health runs Behavioral Health Charlotte. The health system has called this a national problem, but assured us it does everything it can to ensure each patient receives appropriate care and the best possible outcome for their situation. Nate Morabito, WCNC Charlotte.